So how does a girl from Texas end up in Delta?
Actually, I was recruited. So I've been a PA for about 13 years, and my kids went to college, and so I decided to start a new adventure and work somewhere else. And there's also a nice benefit of rural health where you can get some student loan repayment, which is very nice. So it's nice in family practice. It's really challenging to go from specialty to family practice, especially rural. I mean, the family docs deliver babies. You know, everyone does everything. But in rural America, you do find that there's less access to the help that people need. They can't just, like in Dallas, you can send them to an inpatient rehab within 36 hours. That's not going to work here. So as family providers, family practice providers, we're doing all kinds of things that were not probably something I thought I'd be doing as a PA, you know, unless I was in substance abuse or in, you know, mental health. But everything is here. So
we do all levels of students. So we do students all the way from MA students all the way through physician rotations and NPs, PAs, the whole gamut. That's one of the ways that we feel like we can recruit because once you get here, you want to stay. I think the biggest draw for the providers is training new providers and getting them a good start. And I know recently, within the last couple years, there's now a tax write-off that providers can claim. So that helps a little.
Yeah.
Over the last several years, recruiting for providers has actually gotten a little bit easier for us. And there's several reasons. One, Colorado is a very appealing place for folks to live. And not everybody wants to be in the Front Range metro area. So they want the amenities of Colorado, but want the small town feel and the ability to make a decent living and practice their trade and take care of the community. So honestly, from a practitioner standpoint, most of the folks I've recruited have called me wanting to be in the rural community on the Western Slope. I think one of our biggest challenges right now is recruiting registered nurses. There's a national shortage, and so that's been a real challenge for us. And so we have to kind of think outside the box about what we do to get those clinicians in. We work with a local nursing school. We work with CMU and Grand Junction, as you mentioned, to kind of have that pipeline so that we can get them early on in the process and provide a program for them to start their career. The average physician is coming out with $350,000 in student loans, and it's really hard to kickstart your career and your life with that much burden. And so we've had to look at how we can assist, and again, I think that's a place where the state government or federal government could step in and really assist so that we can continue that pipeline and we don't face national shortage of primary care physicians, which I think is looming. And certainly the registered nurse crisis is here, and I unfortunately think it's probably going to grow before it gets better.
I'm Dr. Abby Urish, and I am a family practice physician in Rangeley, and we have a mixed practice, so I end up doing clinic, hospital, and emergency medicine. So we do inpatient as well as ER and everything in between. So the only thing that we don't do in terms of the full spectrum family practice is OB here.
When we interviewed Dr. Urish, she was just getting out of school, wanted rural, had grown up in Wyoming, and we had hired her, and then in the period of waiting for her to get her licenses and all that, she found Dr. Sutton, and she called and said, you know, I'm getting married, and by the way, he's a doctor too, and So it kind of was a package deal, and one came with the other. But that's how we got them, and they've been wonderful.
I was in Dallas, Texas, and I was long distance dating Abby, and we decided to get married, and she wanted to live in a small town. She's from Wyoming, so I said I'd come out with her. So we've been here for 4 years. So
my husband and I got married right after I finished residency and moved out here. And so we've been working and being married for the last 4 years together. And it is a great relationship. We get to talk about work all the time, which has got its pros and cons certainly, but we really enjoy getting to see more of each other and getting to throw ideas off of each other. The nice thing is, even on maternity, my husband's able to call me and say, I've got this patient, what do you think about XYZ? And so we can kind of throw ideas back and forth with each other.
We've worked very hard to make sure that all of our providers have a work-life balance, having 3-day weekends, and to try and alleviate some of that burnout, because, you know, in a small town, they're always being approached by someone of, you know, oh, what do you think of this spot? Or should I come in for the, you know, there's never an escape from it sometimes.
Now my husband works basically more than 80 hours straight, and that's his work week. And then I have kind of half clinic days with an ER day here and there. So, which an ER day is 24 hours, so it's still a lot, but we enjoy it. So, and I think the volume in a smaller place makes it so you're not going to totally burn out. We have a really fantastic clinic and hospital administration in terms of taking care of their doctors. In the past, I don't think that was always the way that it was, but right now at least we feel very supported in terms of, hey, I need this time off, or I need to switch this ER day.
But I'm worried about them. There's only 2 of them now. And even though they have 4-day weeks, they're the only 2 docs. Because I lost a doctor last year and we didn't replace, and I lost Dr. Ting to retirement this year, and we didn't replace her. So, I don't know, it scares me.
I hope they stay. We've had a lot of doctors come and go, and patients start from square one again. You build a trust in your doctor, and not only do they become your doctor, they're also your friend. And that's hard to establish over and over again.
You know, as part of my job is to make sure that Doug can do his job. And I was trying to explain that to somebody recently who thought I should be my own woman, and I thought, this is our life, and he's the one who's really the breadwinner, and it's my job to take care of the business things and handle all of that, but it's also my job to make sure that he can stay healthy, if I have any control over that, which I hardly do, and be able to do what he needs to do, because he has a big responsibility to our community.
Basket to casket. We take care of newborns to the elderly. I mean, right now I think my oldest patient is 101. I had one of my most favorite patients died at 102. I've seen 4 generations of families since I've been here.
I think Doug has the most wonderful bedside manner. Like I said, I got 3 hugs from him today, and a lot of doctors don't do that. They treat you like a number. They don't treat you like a patient that they have to see every time you come in. They just need to get the numbers through, and then when they've done that, they can go home for the day. But Doug actually worries about his patients and cares what happens to them. A couple
You know, Doug really truly taught me all I know about working with these people. The first day I walked into clinicals here, he said, "So are you gonna come work for me?" And I was like, I don't know. I just don't know about that. But no, he won me over with, you know, his patients and the way he interacts with them. I mean, he and Terry, who own the clinic together, their whole passion is just to serve these people. And sometimes I have even, you know, kind of wondered about like how this business works and care for the community, because sometimes those two things don't match up with each other, you know? I mean, they give so much to people, and people know if they need something, they can come here, and people care about them. I mean, we care about our patients way beyond their appointment. I mean, and it's very apparent with the way he runs things, you know? I mean,
we have talked about succession planning for probably 10 or 12 years because we know that's a reality. We'll stay here till we retire or he dies. You know, and I've said, if he doesn't have anybody to take over, I don't know that he can just walk away from this. And so as far as getting somebody in here, it's a really difficult thing.
So do you think you will retire at 65?
No, I'm already 65. So
We crossed
I
the
just signed a contract with our EHR company, our commuter system, for 4 years a year ago. So I've got at least 3 more years left.
And then do you think you'll be able to kind of hand the reins over to Heather, so to speak?
I don't know if she'd want to do it. I mean,
I've seen the struggle of running this clinic. And I know we're one of 11, I found out, one of 11 independent rural health clinics in the whole state that is still independently operating. And I know that it is very difficult. And not anytime in the near future do I want to take that on. So if Doug retires in the next 3 years, I'm not going to be the one to take over. I can't see myself. I have a young family. I don't think I can devote the time and energy that he does, you know, to it. I don't know what's going to happen.